Hello, this is Tony Breitbach from St. Louis University in the United States. On behalf of the Interprofessional Global and the communications team, we welcome you to our Interprofessional Global Cafe. I will let Dr. Iman talk to you about, she'll be the moderator for today's session, and she'll introduce our speakers. Thank you. Well, thanks for coming.
Thank you. Thank you very much, Tony. So this is Dr. Iman Al-Labad. I'm honored to be moderator for the session today, representing the Arab Network for Interprofessional Collaboration. We are sponsoring and proud to have the session with us today, where we're sharing interprofessional education innovation in Saudi Arabia and Oman. Our first session will be about application of interprofessional education collaboration from the practice sites. We have the session presentation entitled Optimal Creating Opportunity for Practices for Teamwork to Improve Advancement of Learning by Dr. Azad Godus. Allow me to introduce briefly Dr. Azad. Dr. Azad Godus is the head of continuous medical education at King Faisal Specialist Hospital and Research Center in Jeddah, Saudi Arabia. As the head manager of the CME, the King Faisal Specialty Hospital, he has more than 20 years of experience in healthcare industry, focused in learning and development, as well as molecular diagnostic. In 2021, they started implementing the IPE program among healthcare practitioners at their practice site. Dr. Azad holds a master's degree in education entrepreneurship from University of Pennsylvania, as well as a leadership fellowship in learning and development at the Cleveland Clinic. He is a certified instructor and facilitator through the Healthcare Leadership Academy. So welcome, and we are looking forward to hear from you. We will have, after that, we will be having a second speaker with a second presentation, so which is we will have with us the second session on presentation or practice of IPE from Oman by Dr. Maria Pramila de Costa, and we will hand the floor first for Dr. Azad to start sharing their practices from Saudi Arabia. Please feel free to type any questions you have in the chat box. After the presentation, maybe we'll have around 20 minutes presentation, then we'll have 10 minutes for the Q&A, and then we will hand over to Dr. Maria, to you, Dr. Maria. So Dr. Azad, the floor is yours.
Thank you, Dr. Iman. Thank you, everyone. And good morning, good evening, good afternoon to the globe. Thank you very much for this opportunity. I would like to thank Interprofessional Global for this opportunity. I'm honored to be part of the people who I believe this group can make the change towards better patient care. And this is through the implementing the right concept for interprofessional and collaborative practice. Just would like to show that I have no relationship and no conflict of interest to disclose. Allow me first to introduce you to this picture, which is a picture of my city, Jeddah, and it shows here the coast side of our city with the new racing track for Formula One. If you are a Formula One fan, so you will have heard that recently. Now today we'll start our Formula One racing, and this is one of the newest and the last racing track with the fastest racing track in the world. And the reason I shared with you this photo, it reminded me of Formula One team. When you are going to talk about how the team of Formula is working towards one goal, which is the car. In our case, maybe is the patient. But you can see in the picture how the synergistic team is working and how the harmony is there. And for that, you can see or you can hear the maintenance for the car in the Formula One was started by having 5 minutes and improved up to a couple of seconds. And this is, of course, by having the work of the team harmonistically and synergistically working together. Now, what about healthcare? We know in healthcare is total different situation, because first you have multiple capable and knowledgeable people working, but the question, are they working properly together? The second is that the healthcare system itself has a changeable factor when it comes to the patient. It's not like the car, as in our example for Formula One, but in the patient situation, you may have one patient from the same age, same gender, same family, but the diagnosis for a particular disease will be different. So the changeable factor will be different. This is where complexity of healthcare will be there. So from our side, we have to talk about our concern will be focused on how we can provide the proper patient care from all professions, but at the same time, these professions has to work together, learn together. And recent study shows after the pandemic, it's not about two professions or more learning about each other, but also they have to have the sense of the need of each other. It's not about only learning about their roles and responsibility, but the sense of how I need that profession towards better patient care. So we started in our organization to talk about how we can provide better education opportunities for our organization, for our community. And we started to, I would say, do a talent acquisition where we find people who are interested in education or they have education role in their department. So we certified those people to be certified educators where they can deliver or know the tool how to deliver their content from their own specialty. In 2019, we thought about what about if we will work together? What about if these people who we certified them would work together? But we focus also on more skill-based activities and learning practices because these people are knowledgeable, but we want to focus on their practice, that we might feel that we felt that this is going to be impact on the patient. In 2020, everyone was introduced to the pandemic and we were introduced to the virtual world. So we're focusing on how we can create more creative or more virtual learning practices. In 2021, we thought about and we had about the chance to get to know more about the interprofessional education, how we can introduce it to our people. And those people who were certified, we took the elite out of them and we made them certified for being an IPE educator. And we focus on implementing sessions that are related to core competencies. 2022, we started to structure those sessions and our journey will continue to see how we can utilize technology and we can define more opportunities for the licensed field. Because what we heard or what we see about interprofessional education is a very good structure and basis built for the undergrad. But if there will be no work for the licensed people, the people who is on the field, we will not close the loop. So our team was started to have the faculty team who will be responsible about designing the content and the concept of the content that should be for the team and it should be delivered by the team. And we collaborated with the right people. And you can see that we have multidisciplinary team in the faculty where we will have consultants, we will have radio respiratory therapists, pediatric dietitians, quality with nursing background, pharmacists, and other specialties that work together in order to have educational opportunities from a multidisciplinary point of view, targeting a multidisciplinary audience. So from that point, we created our optimal initiative. And as Dr. Iman mentioned, it stands for the opportunities of practices for teamwork to improve advancement in learning. And basically these sessions were focused on design on evidence-based studies and case scenarios. The only thing or the main objective of this We want the audience to highlight the value of IPE. We want them to identify or highlight any potential risk that might affect the patient care. Be aware of roles and responsibilities of their professions. And most thing that we focus on is to have an engagement and interactive environment. So we built our cases based on that. And eventually we had this part of simulation. We will put them on the field with, again, based educational practices that will highlight 3 core strategies. Part of these strategies is collaboration and how they can collaborate together in order to achieve that goal. And as I mentioned, we are focusing on the core competencies where we want to tell our audience how each individual should have a shared value, have a common, or make the virtue is common, the common virtue. And the most important thing we focus on is about the individual has to know the roles and responsibility of other professions than their profession, and how they can create the universal language, the teamwork or the team language that everyone will understand, that makes the information would be the right one to be delivered and to be received in order to make that impactful on the patient. And last but not least, we work on how we can build and improve the team dynamics. Now, our outcomes, based on 12 focus sessions so far, we built and we conducted 171 attendees from variety of profession. I will share it to you with the next slide. These people were from every department in our organization, and there was a chance to everyone to register in those activities. And you can see that we were not focusing only on the few, you may say, few professions. We tried to make it more to everyone who is involved in the patient care directly and indirectly. The majority were from physicians, but you can see we have also nurses, pharmacists, dietitian, lab specialists, physiotherapists, respiratory therapists, and other allied health that could be from ambulatory care, dental hygienists, and radiology tech. But also we invited the admin people. Some of them were managers, directors, executives, and also people who are coordinators. They have admin role, but they are deeply involved with the healthcare practitioners, deeply, such as OR coordinators or transplant coordinators. Our results so far, that you can see that there was a very huge improvement from the awareness of the concept of what is the IPE. So before the session, they were not familiar with the concept itself, and they had this, big awareness about our learning outcomes after the session. During the session, every session, we were asking about ask the audience if the session were supporting the concept of dignity, equity, and inclusiveness. And most of them, more than 95%, were safe to share their comments and their feedback during the discussion of the cases and the case scenarios. And the most important slide I would like to show you out of this, we had 12 roles and responsibilities were new to our audience, where you can see, for example, in the graph that, for example, case managers, not all of the audience knew what is the role and responsibility for case managers towards patient care. But also, what is interesting is even for some audience, the nursing clinicians, and here the nursing clinician is not aware they didn't know about their roles and responsibilities. You can also have the dietitians, the RTs, the speech language pathologists, physiotherapists, were clerks, the OR coordinator. They were new to our audience about their roles and responsibilities towards patient care. And on a long-term assessment, we decided to ask the people after 6 months about if this session helped to change the team dynamics attitude. Majority agreed about that. They said that this has been what has been learned has been applied afterwards in their duty time. But one of the key words that we took from there, that people who attended our session felt that this session improved their communication. They were felt empowered after addressing or having competency towards the core competencies. They felt that everything was, or they had a trustful environment, and they thought that this is going to be impacting on the patient satisfaction afterwards. And we afterwards, we received, based on our initiative, the National Patient Safety Award. And from that moment, we decided, or we thought, or we had this awareness about we are on the right track. We see that this is going to be impacting patient safety, impacting patient care, patient experience, and other benchmarks that can be handled by education and training, can be handled by the interprofessional education. And for that, our next step will be how we can link between education and patient care. So our faculty started to have cases to be built to improve, for example, the role for speech language pathologists in post-craniotomy post-op care to reduce aspiration rate. We also will work with the pathology department in order to utilize the lab testing and improve the turnaround time, reduce the delay of the testing to have or improve the ratio between the routine and stat lab orders. We will try to work also with the renal dialysis and nephrology department in order to improve that plan for hemodialysis patients. And we want to work with the right people. And at the same time, recently we are working on building some virtual educational content through VR and see how this can also be impacting our capabilities and our skills and practice for our healthcare practitioners. And also I'd like to announce that our organization has been accredited by the Joint Accreditation for Continuing Interprofessional Education to be the first in the kingdom and the second in the Middle East. It has been accredited by the American Council for Continuous Medical Education, the American Nursing Accreditation Center, and the American Council for Pharmacy Education. And we're proud that this is impactful. So we are doing the right thing. Hopefully we are doing the right thing. And as we mentioned, our focus is to work with the right people in order to make this impactful in the future. Thank you very much. And I believe that it's about making things better together. Thank you very much.
Thank you. Thank you very much for the really inspiring and practices. We know how it's difficult to bring interprofessional collaboration or practice in the practice side. So this is a really great initiative. This is amazing role model for us in most of the countries, not only in the Arab region. So I will ask if there is any questions. If you have any questions, reflection to share with us? So maybe I would start with the first questions. It is a really insightful presentation. Thank you, Zahra, for your comment. So the attendee were a practitioner in the King Faisal Hospital, or it's open for different practitioners throughout Saudi Arabia?
We started by having it internally for our staff, but after 10 sessions, now it's open for everyone. So we are announcing if anyone would like to join, because this is where the collaboration concept will be. It's not about having one individual point of view. So it's now about dealing with the organization as individual. So you need to have another from another individual. So you will have the concept of multidisciplinary point of view, multidisciplinary perspective on organizational level. So yes, yeah,
and this
because
to
we start,
bring.
yeah.
So we have a question here. Would the sessions will be voluntary, and do participants sign up for the session from Kate? Thank you.
Yeah, you can register in the session and you can be participated in. The only thing so far when it comes to our session, the optimal session, is the physical attendance. Because of the part of the simulation, we felt that this is going to be more engaging for our participants if they are going to attend physically. But everyone is welcome to attend.
Thank you for the clarification. Zahra is asking a question. If you have educationists by expertise in your team, do you break that wall between the health and education?
This is a very interesting question. We started, just to share with you the story. The first thing we started when we could, I would say, do the talent acquisition or the headhunting for our faculty, we missed our very important part, the physician part. And when we started our first session, one of the audience was a consultant neurologist, and she mentioned that she wants to join the team. She wants to be part of the faculty. But again, to answer the question, yes, we have educations and we have healthcare practitioners at the same time. I think personally, because I am a person with a clinical background and I shifted to be in an admin role, so I have this kind of middler in between. So you can say I can do the filterization. And also, any educationists in our organization, even with an admin role, they have this part of being competent for medical terminology. So they can understand, and there's going to be part of breaking the ice. Because one of the tricks that we are doing in our session, that it has to have a break ice activity at the beginning. And the break ice is to bring everyone on the table and start from their not only background, but from their being a human being.
Thank you very much. So we will now move to our second presentation, and then maybe we will have a further discussion at the end. So Dr. Azad, you really explains how the interprofessional training on the practice side and how it's important to actually bring to the patient care, because we have been reporting and seeing barriers between education and practice. So we will see that our students are ready, maybe collaborating, learn about IPE and their academia, but then when they go to the practice side, the barriers there, they want different system. So they like be in a shield bubble, and then they go to the practice and realize something is different. So now we will move on to see this, the educational perspective for the undergraduate students from Oman. Dr. Azad, you may stop sharing your screen. So, and let me, during this time, introduce you to our second presentation about health professional students' attitude, perception, and readiness toward interprofessional education and practice in Oman by Dr. Maria Pramila Di Costa. Dr. Maria has been an assistant science teacher nursing at Oman College of Health Sciences, North Batania branch, Sahar Sultanate Oman since 2011, with over 20 years of teaching experience in nursing college in India and Oman. Dr. Maria is a doctorate degree holder in nursing from JJT University in Rajasthan, India in 2022. Her dissertation title was Health Professional Students' Behaviors, Intentions to Engage in Interprofessional Education and Collaborative Practice, a theory-based study. Dr. Maria is very passionate about engaging in academic research with a focus of interest on IPE, simulation, nursing education, and other epidemiological methods. She is an active researcher in several academic research collaborations locally and internationally. She also peer review multiple publications in reputable journals. Dr. Maria is active a member of several international organizations, such as Sigma Theta Tau, International Honor Society of Nursing, International Nursing Association for Clinical Simulation and Learning, and an active research information management member. So without further ado, I will hand the floor to you, Dr. Maria. We are all looking forward to your talk.
Thank you, Dr. Emma. Can you hear me?
We can hear you well and see the screen.
Okay. Good evening and good morning, some of the part of the country, and greetings from Oman. It's truly an honor to be here with such a distinguished and the diverse group of professionals to speak on the digital development of IPE in Oman. I can't move the slides. Okay. I would like to introduce the co-author of the study, Dr. Firdaus Jahan, the professor, HOD of Family Medicine, College of Medicine and Health Sciences, National University of Science and Technology, Sohar, and my colleague, Dr. Amal Al-Shidi, Senior Science Tutor, Oman College of Health Sciences, North Patina Branch, Sohar. On behalf of my co-authors and myself, I welcome each of you to this presentation. Before I get into the details of my study, I wish to brief you about Oman and its contribution to the health profession education. Sultanate of Oman is a country which is located in the West Asia on the southeastern coast of the Arabian Peninsula at the confluence of Saudi Arabia, confluence of Persian Gulf, as well as the Arabian Sea. It is one of the GCC countries with a population of 5.27 millions. It has land borders with the Kingdom of Saudi Arabia to the west, Kingdom of Yemen to the south, and United Arab Emirates in the north. Oman is administratively divided into 11 governorates with 61 vilayats. Why IP? As we were contemplating the need to have an IPE, we came across some of the global challenges which we are really facing today. The first challenge is that a worldwide scarcity of trained health workforce. According to Global Health Workforce Statistics, the estimation of 18 million shortfall of health workforce are required for the need to cover the universal health need. Okay. However, the WHO has set a minimum threshold of 44.5 health professionals for 10,000 population. In a recent study that reviewed the status of national healthcare system in the GCC, also identified the similar challenges such as inadequately trained health workforce, insufficient numbers, skill imbalance, gender disparity, and the allied access challenges. If you see this chart, according to the Eastern Mediterranean Health Observatory, the sources from Ministry of Health 2000 Annual Report 2018, if you see the density of the doctors and the nurses in Oman is around 65 in 2018. And if you see in 2020-21, it is around 63.8, it is still down. Compared to the rest of the GCC country, it is still lower. Oman healthcare system comprises of both the public and the private sectors. Most of the health professionals are employed in Ministry of Health hospitals. For an evidence, 67% of the health professionals are in Ministry of Health, whereas 7% in the non-Ministry of Health organizations, and 26% of them are in the private sector. Oman is highly dependent on non-Omani health workers as well. That's how you can see variation in the clinical competence and high turnover rates. However, there has been a significant change observed in more national health professionals joining the health workforce in the last 2 decades. So there is an upward trend in the propositions of Omani health professionals in the government sector from 1990 to 2021. So during 2021, for every 10,000 population, there are almost 20 doctors and 44 nurses in 2021 compared to 9 and 26 in 1990. All of this, the upward trend is ongoing, and I think it is driven by the Omanization policy in both the government and the private sectors to equip the nations with more Omani health professionals. The health sector has already reached 73% of Omanization at MOH and 65 at non-MOH and 14% at the private sector. The second challenge is the failure to meet the recommendations of the Lancet Commission report, such as the mismatch of competencies, professional silos, fragmented learning. That is how there is a need to transform the health professional education for the 21st century is necessary. Before we, at this point, it is better to know what Oman's contribution to the health profession education. There are total 57 universities and colleges in Oman. There are 2 public, non-MOH and 9 private universities. 6 and 18 colleges under public and the private sector respectively offer the health professional courses, various health professional courses. MOH hospital mostly recruit the graduates trained from the Ministry of Health Higher Education institutions, now which is called as Oman College of Health Sciences. Oman College of Health Sciences have almost 8 branches across 8 governorate and 1 health institute of health specialties in Muscat. And Muscat branch is the central branch of OCHS, which comprises nursing, allied health courses such as medical lab, BPT, and bachelor's in radiotherapy, pharmacy, as well as the health information management courses are offered. While the other branches are having only the nursing program and the foundation programs. So yearly, there will be an intake of 550 to 650 students, intake around 550 to 600 and around 650 students graduate every year from OCHS. Among the 9 private universities, one of the private university, National University of Science and Technology, which has a College of Medicine and Health Sciences called COMS, where the medicine and the pharmacy programs are offered. And it has 2 branches, one in Muscat, another in Sohar, which is very close to North Patina branch, where we live. And the third important challenge that we face is the failure to have the sustainable healthcare system. In order to have a sustainable healthcare system, there should be a competent healthcare professionals who can work in teams and collaboratively. So generating a collaborative practice-ready workforce with a mindset to work in teams where really the IPEP comes into picture. So therefore, the scaling up of the professional education is required. Health reforms have globally recognized the importance of IPE, and it has been widely accepted creative approach in solving the health professional crisis globally. One of the famous or the popular definition of IPE defines IPE occurs when 2 or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. IPE promote mutual respect, trust, and understanding roles and responsibilities of other professions that enable for this shared decision-making skills, teamwork, confidence, and effective communication among the health professionals, thereby generate a collaborative, practice-ready workforce. The benefits of IPE has been widely accepted and it is beneficial to the varied stakeholders such as patients, students, institutions, and educators. For patients, it would improve the patient outcomes and ensures optimal patient care when the efficient healthcare team provides the care. For students, IPE is appreciated for generating the diverse skills and expertise which are essential to become the collaborative workforce, whereas for the institutions and education that will enhance the role dynamics among the health professionals, encouraging them to work efficiently and communicate effectively. Now, the most important question, are we there yet? Unfortunately, I don't have a definite answer to it, either yes or no. As per my knowledge, initiatives have been taken to appreciate interprofessional education and practice and understand the need for IPE, at least in one of the pioneered public university of Oman, Sultan Qaboos University, and the private university, National University of Science and Technology, through various publications and the IPE activities. But there are some evidences what has been done in Oman. First of all, Gillian White in 2012, first time she linked the health professions education to the health systems in Oman. At that time, she was a senior consultant for the Ministry of Health, and she had made an extensive reference to the Lancet Commission report and its recommendation for new instructional and the institutional strategies for designing education system for healthcare professionals. I think it was a point of reflection to reflection for the health professional educational bodies to refine and reform the curriculum through the competency-based curriculum, adding core competency to provide transformative and interactive learning and interdependence in education. Not only that, the restructuring the medical education and strengthening the professional training and the infrastructure was one of the priority in the 9th five-year plan. Ministry of Health higher education institutions were upgraded from the diploma courses to the Bachelor of Science program. However, there was no integration of any sorts of IPE activities. So, the structured IPE curriculum and the rigorous strategic disciplinary plans to uphold the collaborative values are awaited. Although several articles have been published regarding IPE, I feel IPE in Oman is still an evolving term for many, especially the health workforce students under MOH. So IPE literature appeared to limelight since 2012. Some of the studies published, most of the review studies published in SQ University, and there's a systematic review also was conducted by the faculty of Ministry of Health, that is faculty of higher specialty education in Ministry of Health, Mr. Saeed Nasser Al-Harthi, and two studies came up. One is pilot study, and the full-blown study was also conducted from Sultan Qaboos. And this is the study, and therefore we thought that we need to know what is the perspective of the stakeholders, especially the students, regarding the change of paradigms of teaching and learning through IPE. So that's how we came up with this title, Health Profession Students' Attitude, Perception, Readiness towards Interprofessional Education and Practice in Oman. The aim of the project was to examine and compare the attitude, perception, readiness to IPE and practice among health professions across the discipline, and to find the significant difference in the mean attitude, readiness, and the perception scores based on the demographic variables. The research methodology that we used a quantitative survey approach with a cross-sectional study design. All the health professional students studying in OCH branches and the College of Medical and Health Sciences at National University North Patina branch where the population, the sample included from medicine, nursing, pharmacy, allied health courses, radiography, MLS, physiotherapy, and HIM. We use non-probability convenience sampling, and the sample size was 327. The criteria that we set for inclusion of the participants in the study were the health profession students enrolled in the undergraduate courses studying in the year 2, 3, and 4 of nursing, pharmacy, allied health, and medical students in their pre-medical, preclinical courses and the clinical courses. The foundation students and the year 1 students were excluded from the study. The study setting, the study was from all the branches of OCHS and the College of Medicine and Health Sciences at NUST, especially the North Patina branch. The measurement and the tool, the authors, we collected the data through two pre-validated tools. One is about the Readiness for Interprofessional Learning Scale, which is a modified one by Curran et al. In 2008, which measured the teamwork and the collaboration and the professional identity, which had 15 items and good internal consistency reliability score. The second tool that we used is the student perception of interprofessional clinical education, which is the revised form, SPICE R2 by Zorek et al. In 2014. It measured the perception towards IPEP in 3 different factors: interprofessional team and team-based practice, roles and responsibilities for collaborative practice, and the patient outcomes for collaborative practice, which had 10 items, and the internal consistency reliability was 0.83. So both the tools were highly reliable, and we got the permission from the authors to use the tool. There was no modification made to the tool. Pilot study was conducted with 15 samples, and the tool was administered in English. There was no difficulty to understand any type of questions, so study was found to be feasible. The research and the ethical review and the approval committee, RERAC Muscat, and the ethical and the biochemical committee at COMS at NUST, North Patina Governorate, approved the study. The data was collected through the student emails. First, we contacted the student affair coordinators. We collected the emails, and then formal invitation was sent to the participants with the survey link along with the participant information sheet and the e-consent. The anonymity and the confidentiality of the subjects were ensured. 3 reminders were sent for the students with a gap of 10 days in between, and the data was collected over 2 months. Data analysis, we used a statistical package for social science, version 23, descriptive and the inferential statistics were used. Besides, p-value 0.05 was chosen for the level of significance. The study results, first, the characteristics, a total of 327 respondents responded to the survey. Majority of them were in the age group of 19 to 21 with a mean of 21. Majority females, 79%. Total type of disciplines, majority were from nursing. And the level of education, the year 4 level of education, almost 35%, and the prior experience of IPE activities, 219, that is 67%, had no prior exposure to any form of IPE approaches. There was no statistically significant difference in the attitude and readiness scores and the perception scores based on the demographic variables. This table explains about the attitude and the readiness scores. Overall, there was a mean score of 56.77 with a standard deviation of 5.51. However, the pharmacy students had slightly higher mean scores compared to the other professions. However, there was no statistically significant results. The next table talks about the perception scores using SPICE R2. Even the overall perception scores were 41.42 with a standard deviation of 4.56. Here also the pharmacy students had higher scores, 42.81 and 3.67 standard deviation compared to the rest of the disciplines. Again, there was no significant significant difference in the scores with the other professions were noted. The conclusions and the recommendations. Omani health profession students disclosed a favorable attitude, high state of readiness, and positive perception towards interprofessional education and practice, and they valued teamwork and the collaboration as essential. The healthcare advocacy is needed to offer practical and efficient healthcare services and ensure the best outcomes for Omani patients. Therefore, the introduction of IPE into the health profession education has the potential to do this. So this study provides a broad and a sound foundation for the future IPE studies and call for a change in the way the health professions are prepared to practice. So students' awareness of IPEP and being positively inclined towards the interprofessional education demonstrated the readiness for change in the pedagogical strategy. So the initiatives at the institutional and the national level towards the culture of teamwork and the collaboration through curricular changes are warranted at this stage. Since the limited studies have been reported on these aspects, in the current study setting, it needs covering a more extensive group of students, potentially influencing the quality of care. Limitations of the study. Firstly, it was a cross-sectional study design. The attitude and the perceptions that change over time could not be captured. The lack of representativeness of the sample due to the convenient sampling would limit the generalization of the findings, and the comparison of the subscales are not studied, only overall attitude and the perception were analyzed. Now, I am glad to know that our future collaboration with Arab Network for Interprofessional Collaboration and as co-sponsors for this Global Cafe, Mr. Syed Al-Harthi is a faculty of Higher Institute of Health Specialties, is executive committee member, and I believe this would be an avenue for future global collaboration. I would like to acknowledge acknowledge students who participated in the study, and thanks to Dr. Avatif, who is a student affair in charge, all the focal points for research and all the associate deans of OCH's branches and the dean of students from National University, and a special note of thanks to the authors who have permitted us to use the tool in the study. Thank you. That's all.
Thank you. Thank you very much, Dr. Maria, for the really inspiring talk. And actually the question, are we there yet? It is all of us are asking these questions, checking our readiness for IPE, the positive perception from the students in the undergrad, postgrad, and then we have the practice site where it seems IPE start to implement it. So I'm very optimistic that we are on the way. Yes, we need to work more, but having the champions that we see here in the session and attending your effort, our collaboration, all of us bringing academia to practice, I'm sure it will make change, but we will keep asking, are we there yet? And there is a lot of future opportunity for multiple research in the field. So I will please start maybe with the attendee if you have any questions. Yeah, we have the first question from Dr. Muhammad Al-Mansour. How do you think we can overcome the rigid system of courses in higher education in the Gulf country to introduce IPE to health science education?
I think unless the higher authorities realize the need for IPE and develop the national policies towards implementing IPE throughout the educational settings, things won't be that easy. So even many people are interested in working with IPE, but they cannot independently work, which requires lots of collaboration, requires a lot of efforts in terms of resources. So I think if there is a government policy which we can really work on it.
So the policy, the accreditors, maybe from our education side, we have a comment from Kate. He said, I suppose in the UK, the professional body require IPE in courses. So this was helping in the UK. Hopefully in our Arab regions, maybe we will start to have that. Maybe I will hand over to Dr. Azad. Do you have any practices or a thing related to IPE in Saudi Arabia? Or from professional licensing, maybe, or you are muted, Doc.
Yes, I think realizing challenges for IPE. Now, challenges could be institutional. So the institution is not believing in IPE or underestimating the value of IPE. It could be from the faculty or could be from the assessment. Regulatory might be also a challenge that if you put this in front of you to make it as what you are doing is accredited or has been endorsed by regulatory body. And this is where we started by being the accredited provider for continuous IPE education. So we are telling people now, even internationally, this is very important. So afterwards, it might let the people join in, because I think it's about how you approach and propose your idea, where to see that this is going to be impactful, this is going to be eventually even beneficial for the participants themselves, because they will not have conflict that will handle every now and then. They will have this kind of improvement in their skills when it comes to problem solving, other interpersonal skills. So showing them that this is going to be beneficial and believing or the institution itself will be believing in that, I think it might be going to ease the process of how you build in the practice. Taking the best practices or best model happen outside and see how the outcomes went. So it's shown to them how we can utilize this in our Arab world.
This is really inspiring. So we have a comment from Dr. Siraj saying that the WFME standards now include IPE in the curriculum, and this is the World Federation for Medical Education standard. This is very interesting insights, and I think having both accreditations from education, from the educationist, and also in the practice side, from the clinical side, will bring things in. Having the holistic system approach for the healthcare system and for the patients, and start to think for integrating education with the academia and work together to bring up the barrier, because the preceptor, it's ending up that our students in the clinical training or in the education go to the hospital sites, so they will be perceived with a preceptor. So if the preceptors are certified with the IPE or have a background, this is a huge thing. And then when they practice in a culture that advocate for interprofessional collaborative practice, I think we will bring what we can say, stop being in silos. Yes, we will stop being in silos. Amazing. And Dr. Siraj is commenting, regulatory enforcements are always a boon or advocate for IPE. And actually, we are starting doing this in the UAE. Hopefully, we can have educational accreditation standard. We'll establish a project on that. On the IPE, hopefully, we can proceed with this in United Arab Emirates. So, any questions for Dr. Maria about their interesting research study, going back to the education and the students' readiness?
Just one comment, Dr. Iman. I think what you have mentioned now, this is one of the main reason about this amazing group. You're talking about how you can share experiences. It's about how we will help each other. It's about helping each other, how to make it work, because we can see it. Our session, we are sharing with our audience some other examples happen, and you can see it tangible. You can see, for example, coming from Cleveland Clinic. Cleveland Clinic was the 5th best hospital in the States, moving to being the 2nd best hospital in the States after implementing the Cleveland Clinic experience. Major part of the Cleveland Clinic experience was based on empathy program and boost program, which is for the building opportunities for teamwork, which is the IPE session. So it's about sharing experiences together, help each other to make this more impactful. Recently, Cleveland Clinic has the health education campus where everyone is studying together. Physician, assistant physician, dentists, pharmacists, nurses, everyone is studying together. So I think learning from each other will make this is part of the teamwork that we talked about. It's about teamwork and how the team can make more outcomes. It's about the synergy equation, which is 1 + 1 will equal more than 2.
More than exactly. Thank you very much for the comments and the reflection. Dr. Maria, would you like to reflect? Please.
Yeah, I think even the preparedness of the students to face such a complex system of IP curriculum is important. So they need rigorous orientation to the structure, not only to the students, also to the faculty. If I talk about the perspective of the educational perspective, this is all to be kept in mind, to be considered. Like we have in our college, as one of Dr. Siraj is with us. He's in the National University of Health Sciences. After he has joined, I think lots of sessions on IPE has been conducted, and our students were given some opportunity to collaborate in those activities, which is happening slowly. So I think in few years we are also there.
Yes, I believe we are there. And as we mentioned, having these initiatives, the global cafes, where we can share experience, reflections, it's really make difference having the network where we all network together towards the optimum, which is the patient's care and the better outcome for the patients and our healthcare system. Thank you. Comment from Dr. Siraj. Thank you, everyone. This is inspiring, and my mind is overflowing with idea of cooperation and collaboration. And we are all here, Dr. Siraj, to collaborate with each other to see how we would implement or moving forward with IPE from education to practice to a holistic system throughout the globe, not only the region. I see we're exactly at our time. It is 1 hour. So I would like to really thank you for your outstanding, amazing session, Bridging Academia with Healthcare, for all the attendee. The session recording will be available and shared on the interprofessional.global cafe website. Maybe I will have a final remarks from everyone who is attending for last questions, reflections.
Thank you, Dr. Emma, for your wonderful moderation. Thank you, Arab Network, for giving us a chance to present.
You are welcome, and you are welcome. Thank you.
Thank you for the opportunity. Thank you very much.
Thank you. I'm sure we will be communicating and collaborating more. Thank you, Judy, Saeed, Siraj, Zahra, Josephine, Craig, Erica, Iftikhar, Jenilyn and Wilbert, for joining us. Thank you very much.